Hi everyone. Welcome to another session of Staying Connected with the Worcester Senior Center. I'm Dr. Michael Hirsch, the Chief Information Officer for the pandemic for the City of Worcester and the Medical Director for the Division of Public Health for the City of Worcester. And we've become great friends now over the last year doing these sessions together where I try to give you the latest information about what's going on with our COVID-19 pandemic. And I'll also talk about some other public health things today because it is summertime, and summertime is an important time for us to be out and about, and hopefully you will be able to do that as well. So when last we spoke, I actually was able to film one of these sessions up at the Worcester Senior Center on the day of the grand reopening. And I hope that you've been able to take advantage of that reopening. If you were a regular Senior Center attendee, it's back and it's in full swing, and we're starting up a little clinic there as well, so you can get some of your health care done there, blood pressure checks and diabetes checks, and even some medical advice from one of our wonderful public health nurses, Amelia Houghton, who runs that clinic. And of course, the Senior Center is such a wonderful place to be together with your fellow seniors and to kind of have great activities, whether it's arts and crafts or music or just hanging out and having a sandwich at the cafe. It's a great place to be. So that's what we were hoping this summer would be like. And for the age group that we are talking about at the Senior Center, the older than 65 age group, you have a very, very big advantage over the rest of the city because you're about 95% vaccinated. That's an amazing number, and it's a real tribute to the fact that you all felt the need to get vaccinated, and you complied with all the rules leading up to getting to the vaccination, which was about 9 months of obeying the 3 W's, wash your hands, watch your distance, wear your masks, and you made it. And you got this terrific vaccination, which has proven to be amazing at driving down the incidence of COVID-19. But we have a little bit of a flare-up going on, which I want to talk to you about honestly. As of this taping, I don't really completely understand which way things are going to go. But right now, I would tell you that the landmark that we reached this week was that 60% of those vaccine-eligible people in the city of Worcester, 60%, have gotten fully vaccinated, and 66% have at least gotten 1 dose of the vaccine. That is a very good number and much better than the national number, and it's a reflection again of the intelligence of the people of our city and the Commonwealth in general. We are one of the highest vaccination states in the Union. And that has really brought out what has now been called by the CDC the problems of the pandemic of the unvaccinated, okay? The Delta variant, the variant that used to be called the Indian variant, has now been renamed the Delta variant. They're naming all of the different mutations of the COVID-19 virus after Greek lettering. So the Greek letter Delta, D, is the current strain that's taking over the country. It started coming over here from India in early May. By the end of May, it was only 7% of all the cases. But because it is 60% more transmissible in the unvaccinated population, it started to really take off. And that's why now it represents about 80% of the cases that we see. We also know that the vaccination that you all got, the Moderna or the Pfizer mRNA vaccination, or the Johnson & Johnson DNA vaccination, do a great job against this variant. So what we are seeing now is an uptick in cases, and the uptick in cases is almost exclusively in the unvaccinated population. And we are seeing an uptick in admissions to the hospital and ICU patients, a very small uptick, all unvaccinated people. There are some vaccinated people that are getting tested and found to have the COVID-19 Delta variant, but they're not going to the hospital. They're not getting sick. So that's really what the vaccination was supposed to mainly do. It was to try to keep people out of the hospital, out of the ICU, and unfortunately, to use this phrase, out of the morgue. And it's been doing that job beautifully. We're not 100% sure how long the immunity that you got from getting this shot will last, but so far the tests seem to show that going on close to a year now, the original people that were in the trials for the vaccination still are showing very high levels of antibodies, so that we don't necessarily think it's an automatic thing that we're going to all need boosters. I know that's on a lot of people's mind. Am I going to need a booster shot? Am I going to need a different kind of shot? If I had Johnson & Johnson, should I get a Moderna or a Pfizer booster or something vice versa? We just don't have that information yet. But thus far, there's no evidence that if you got your shot, even in early January when we were able to distribute it to the seniors, that you run out of immunity. Now, the Delta variant is an example of how viruses have their life cycle, right? The virus is only there to try to reproduce itself and spread. Those are the two jobs it has. And when it reproduces itself, it makes copies that don't always jive with the first copy. And most of the copies that it makes are lousy copies that don't have any potential to survive, and they just die out. But every once in a while, the virus will make a copy that is not only more survivable, but more transmissible. It will go other places faster than the original version of the virus. And that's what the Delta vaccine, the Delta variant has done. Fortunately, because the Delta variant still has the same protein on it called the spike protein, and I know you've seen those pictures of the COVID virus where, you know, it's always like a blue ball with red spikes coming out of it. Those spikes, the spike protein, are the same in the Delta variant, and that's the protein that these vaccines teach our bodies to react to, and that's why they're so effective against the Delta variant. So if you're vaccinated, you're still in a very good position. But I think there's some things that we have to realize. 40% of the city that we're in and 40% of Massachusetts is not vaccinated. So in those populations, the virus has a chance to replicate very quickly. And we are seeing a lot of cases. As I mentioned, the cases are going up, but they're not going up in the senior age group. They're going up in the age group between 20 and 40 years of age. Most of those folks don't get quite as sick as some of our elder folks do because they don't have as much in the way of other medical problems, and they also have a little bit better immune systems. But let's say you're a senior and you do have an immune system problem. You've been told, oh no, your immune system is a little weak because you're on some medication for rheumatoid arthritis, or you're on something for lupus, or maybe you have HIV, maybe you have some other cancer that's causing you to need a immune therapy. All of those kind of patients are a little more at risk for getting, even with the vaccination, a COVID Delta variant infection. So those are people that I wouldn't say should throw away their mask. The mask is a friend. And if you're worried about your own health risk, if you make the evaluation that you're a little more vulnerable, a little more susceptible to a bad infection in general, when you go indoors, particularly indoors, to a restaurant, to a shopping market, to a big box store, wear your mask. Now, the city manager made a plea a couple weeks ago at a press conference that we have to be a mask-tolerant city. Last year, everybody was calling the Department of Public Health complaining that somebody in some store that they were in or a restaurant they were in wasn't wearing a mask. Now we have people calling to complain that they were wearing their mask in a store and they were accosted by someone who said, "Why are you wearing your mask? You don't need to wear a mask." We have to be mask friendly. We don't ask questions, "Why are you wearing a mask?" Unvaccinated people are supposed to be wearing a mask. And I wish we saw a lot more masks out there, because I suspect that the unvaccinated people are not playing by the mask rule. They're supposed to be wearing a mask indoors and out, but I don't think it's happening. Vaccinated people don't have to wear masks, but if they prefer to wear masks, we should be tolerant of that choice. I don't think that you have to worry as a vaccinated person about being outdoors without a mask. I think it's very safe. And let me give you some statistics about that. So you might have heard someone call and say, I had the vaccine and I just tested positive for COVID, and I'm really wondering, why did I even bother getting the vaccine if I was going to get COVID anyway? Here's the statistics on this, right? 4.2 million people in Massachusetts, out of about 7 million, have gotten the vaccine, okay? Out of that 4.2 million, 4.5 thousand have gotten a breakthrough infection. That's what we say when someone who's gotten vaccinated tests positive for COVID. That's 0.1%, a very, very low number. So let's say that 4,500 people have gotten this reinfection or breakthrough infection. Out of that number, how many ended up in the hospital? Would you say half of them? Would you say a quarter of them? No. 6% of them have ended up in the hospital. 92% of them have never gotten to go back to the hospital. They just tested positive because they were either exposed and the contact tracing led to them being tested, or they had a head cold and they wanted to make sure, or as you'll see, if you are planning on traveling anywhere, most of the airlines, most of the trains are requiring passengers to show that they've been vaccinated and to show that they have a negative COVID test. So if you got tested and you tested positive, even though you were vaccinated again, that's one of these breakthrough infections. 92% of the breakthrough infections never go to the hospital. 6% do, and the rest, unfortunately, so it's about 1.7%, get a really severe case of COVID and could die. But that's very, very rare. You remember we started out with 0.1%. So if you chop that down to 1% of that dying, that's very, very low. So the vaccine has done an amazing job. We still are, in the hospital setting where I work, we're still masking indoors because we don't know which patients have COVID until we do the testing. But in general, whereas in the height of the second surge, for example, when it was back in January, we were seeing about 120 healthcare workers getting sick every week. We have about 2 or 3 that are sick right now. So the numbers are staggering, proving that the vaccine works. And so I would not be that concerned yet about what's going on in places like Arkansas and Tennessee and Alabama, because they have vaccination rates of like half of ours. 30% of the population in those states have been vaccinated. And that gives the Delta variant the chance to overwhelm the system. That's not how Massachusetts is. That's not how New York, New Jersey, Connecticut are. It seems like our neighbors to the north, New Hampshire, Maine, and Vermont have done very, very well with their vaccination programs as well. So, you know, we're very fortunate in the Northeast that we're not going to see the same kind of flare-ups of the Delta variant like we're seeing in the South, in the Southwest, and even unfortunately in California. You may have heard this week that California decided to mandate masks being worn again indoors for everyone. And we've been tossing this around here in Worcester. We just don't think we're there yet. Could we get there? Maybe. But we're still hoping that some of the increased numbers we're seeing this week, in the third week of July, is a representation of what happened over July 4th weekend, where there were a lot of family gatherings, and because the weather was not great, a lot of those gatherings were indoors, and indoors is a much better place for the Delta variant to multiply and spread. So I'm still very optimistic. But you have to use your head. If you are at all uncomfortable about whether you might get it, don't go to a crowded concert indoors. Don't go to a crowded bar or restaurant indoors without a mask. You really have to, you know, be sensible about it. And if you're outdoors, it should not be a problem. The vaccinated are not going to do anything. The other thing we learned about this is that this was a concern of a lot of elders and parents. Even if you got a breakthrough infection of COVID-19 after a vaccination for it, even if you got tested positive, you are not going to spread that virus. You're not a spreader, because the virus never builds up enough volume in your body because of the vaccine to make you shed it. So you're not a spreader with the breakthrough infection. You're not going to go into the hospital with a breakthrough infection. So don't feel like if you got the vaccine and then got a case of COVID that it was a waste of your efforts. No, you really helped us. You kept the bed in the hospitals from getting clogged up, and you also kept yourself safe. So good for you. So what I wanted to just say about your position in our Worcester community is that many of you, again, are the trusted elders in your family circles, in your neighborhoods. People look up to you for your wisdom, for your experience. And if you've had the vaccination, which I would say 95% of you have had, and you're still here to tell the tale, and you haven't gotten sick, and it hasn't made you feel different, I wish you would spread the word. Spread it to your neighbors, encourage them. You may be the trusted messenger that we at the Department of Public Health have been looking for to get the word out. It's one thing if a doctor says it, it's one thing if the mayor or the city manager says it, but it really helps if somebody who's trusted in the neighborhood, trusted in the family, decides that they're going to take a stand and say, this vaccine is the right thing to do for our community. And it really is. It will keep us from having to take a step backwards and start wearing masks indoors again and things like that. Now, coming down the pike, we have some really exciting developments going on. They're currently, as we're sitting here, doing tests on vaccinations for the children between the ages of 6 months and 12 years old. That's roughly about 12,000 children here in the Worcester area. And that's probably the largest chunk of unvaccinated people that we have left. The trick with that group is that you can't just give them the adult dose of the vaccine. We have to somehow come down with a weight-dependent dosing system, and that's a little tricky and takes a little bit longer. So the predictions that I've seen is that the FDA is going to look at all of the numbers that Pfizer and Moderna come up with probably by September, and over the next 3 months they will validate those numbers and decide to hopefully give us emergency approval for that age group by the time the kids go back into school for their winter-spring semester in January. And I undoubtedly will be very involved with trying to do a vaccination program for that group, try to get them all vaccinated so they won't have to wear masks anymore in school, because for now it looks like they're heading back to school in September, they're going to be asked to wear masks. They are not as likely to get sick, even with the Delta variant, but they can spread this, and the spread between their unvaccinated parents and them, and then back to others, is something that we want to try to avoid in any event. And if you remember, I think we mentioned this on a previous one of these broadcasts, last winter, because everyone was wearing masks, we had a much, much lower flu season than any of us expected. We thought there was going to be what's called a twindemic, when the peak of the COVID virus and the peak of the flu virus were going to coincide. We were thinking that the hospitals would be flooded, but because the masks were being worn, flu just didn't really take off last winter. And the same thing with some of the other pediatric viruses that get spread around from coughing and droplets. There's a virus called RSV, which many, many children come down with over the course of the winter. We didn't see much of that last winter. So, in Asian countries and in some of the European countries, they may decide to wear masks in the winter anyway, regardless of what happens with the COVID. And meanwhile, we're also trying to figure out how long will this immunity that you have from the original shot last, and whether or not you're going to end up needing a booster shot. The most aggressive statement I've heard about booster shots is that folks that have gotten Johnson & Johnson, which is a DNA based vaccine, they might be the ones that we ask to get a one shot of the RNA vaccine, either Moderna or Pfizer, as a booster. And as far as the rest of us, the ones that have gotten the mRNA, the jury is still out. We still see excellent levels, as I mentioned, of antibodies now going in that trial group for about a year. So we may not have to have a second dose. We will want to emphasize again getting flu shots, particularly if vaccinated people aren't going to be wearing masks, because we could see flu flourish again without the masks being worn. So I think that's all I really had to say about the COVID issue, but I did want to say some basic things about the summertime. As you know, we've been having a very wet summer, a very hot and muggy summer. Now, with all of the rain that we've had in this very rainy month of July, this is a very dangerous time for what we call the arboviruses. Arboviruses are the ones that are transmitted by mosquitoes, right? So that's West Nile virus and Eastern equine encephalitis, or triple E virus, are mosquito-borne. And we are concerned that because there's so much stagnant puddles of water and swampy areas that have been overflowing because of the brooks that have had too much water running down them, that we might see a big surge in mosquitoes. Now, Worcester has a spraying program. We're part of the Massachusetts Mosquito Control Project, whereby we are testing constantly mosquitoes that are caught in different precincts in Worcester. And if we find that one of them has a positivity for any of these arboviruses, that's an area that they target to do aerial spraying, sometimes spraying from ground trucks or from people carrying tanks. And also they put special larva killing material into standing water to make sure that we don't see a big crush of these mosquitoes. So far, there have been 9 cases of West Nile mosquitoes retrieved around the whole Commonwealth, but they've all been from Bristol and Plymouth and Barnstable County. So we've been so far safe here in Worcester. But what we always say when it comes to mosquitoes is you have to follow the 5 Ds. That is dawn and dusk, that's 2 of the Ds. Those are the times when mosquitoes like to go out. So if you can avoid going out during those times, please do. Then, of course, there's DEET. So that means using an insect repellent containing DEET is a very important adjunct. You can spray it on, you can wash it on. There are these towelettes that you can put on yourself to put DEET on. And then the way you dress is very important. If you're going to go out in the dawn or the dusk period when you know the mosquitoes are out, try to wear a light long sleeve outfit or long pants instead of shorts, because that will reduce the amount of surface area that the mosquito has to bite you. Some of those clothes that you wear can be impregnated with permethrin, which is a chemical that you can either buy yourself and put on your clothing, or you can buy clothing that's already pre-impregnated with permethrin, and that can help repel the mosquitoes. And then the last D is draining standing water. So if you have bird baths, if you have different little pools or things in your garden that might receive this water, don't let them sit there and stagnate. Dump them out. Make sure that they're not becoming a breeding ground for the larvae of these mosquitoes. So the other piece of this is that in the sun, especially in the elderly, you don't have as much protection. Your skin is a little bit thinner, and you're much more prone to sunburn and dehydration. So you have to limit your sun exposure. So we've been always recommending hats and limiting your time out in the sun, making sure you're keeping hydrated with a bottle of water, and try to get to a cooling place frequently, and apply SPF 30 or higher sunscreen so that you don't burn. These burns are not just annoyingly painful, but in the elderly folk, they can go much deeper into your skin than you realize, and you can end up with scarring and long-term pain in these areas where you've gotten burned. So that's kind of sun safety that I can talk about. And the last thing I will just mention in general is that if there are elderly folks in your neighborhood that are less mobile than you, that might be considered homebound, and it happens to be a very particularly hot stretch of weather, come up with a buddy system whereby you can check in on each other. Some of the elders do not like to use social media or computers, and the good old knock on the door or the good old landline telephone call just to see how they're doing. If they've been so hot they couldn't venture out for food, maybe you could come up with arrangements where they can get some meals delivered to them. I know the senior center delivers thousands of meals every month to folks that sign up for that service, and I would urge you to look into that if you're in that category that just doesn't feel like you can get around to do shopping or get out to a restaurant or do any takeout or anything like that. I think that the summer of 2021 is still going to be certainly much better than the summer of 2020. I do think there's a lot of media hysteria around the Delta variant. We are not in the same situation as Alabama, but if you watch television and the TV news, it makes it sound like the entire country is going under. Yes, all 50 states right now are seeing an increase in the Delta variant cases, but this is not an equal playing field. We have a very, very compliant and smart population that has agreed to get vaccinated, and that's really the key. This is a disease and a plague right now of the unvaccinated. And anything we can do to crack through to make an unvaccinated person convert into a vaccinated person is a win. So I'm going to ask you all again to help us win by making your neighbors, maybe your nephews and nieces, your kids, understand how important vaccination is. The individual choice of getting vaccinated is not really your own, because you are protecting not just yourself with the vaccine, but you're protecting all the neighbors and friends around you, and of course you're keeping the hospitals from being flooded with new Delta variant patients. We don't want to go back there. My medical colleagues are really, really exhausted, and they were looking forward, as all of us were, to kind of coming through this wonderful summertime with no restrictions and just like getting back to normal. And now we've had to pull the reins back in a little bit. But I still think it's going to be a good summer if we can do some of the things that I've talked about, if you help us, and we'll continue to chat like this over the next several months, and hopefully we'll see that we have weathered this particular bump in the road and gotten through to a beautiful autumn that we love so much here in New England. So thank you very much for listening. I hope you're all staying safe and well, and we'll see you soon again on Staying Connected here with the Worcester Senior Center. Bye-bye.